Welcome back, everyone. Across the globe, governments are grappling with how to sustainably fund healthcare, reduce out-of-pocket expenses, and ensure that no citizen is left behind due to inability to pay. Tonight, we'll be diving into the key pillars of health financing reforms, the complexities of expanding health insurance coverage at scale, and the practical steps needed to enroll millions into mass health insurance schemes. Our guest tonight has consistently focused on mentoring health professionals while driving systems-level reforms in healthcare delivery. Professor Mohammed Adipati, Coordinating Minister of Health and Social Welfare, joins us on Politics Tonight. Honorable Minister, good evening to you. Thank you for joining us this evening.
Thank you for having me, Olajumoke.
Right, thank you very much. Just a few days ago, the presidency informed Nigerians about the new mandatory health insurance coverage for federal workers across all MDAs, as approved by President Bola Tinubu. Why did the president take this decision at this time?
To put this in context, the reforms driven under the leadership of His Excellency President Bola Ahmed Tinubu in the health sector, the goals are to save lives, reduce physical and financial pain, produce health, and to do so for all Nigerians. In other words, to ensure that health outcomes are better, but also that there is financial protection, that the access is matched with affordability, as well as equity, to ensure that we don't leave our population behind. Nobody should be left behind. In the last 2 years, we've worked very hard to expand access to different levels of care with investments. But there are households, and many of us are still bearing the burden of huge expenditures from cost of ill health and order to access health services. So expanding health insurance, contributions by families, prepayments, will enable families enjoy quality health services when they're ill without facing the risk of catastrophic expenditure or impoverishing health expenditure. So over the last 2 years, there have been succession of reforms within NHIA to strengthen it as a regulatory body, increasing the tariff for capitation, for instance, by 95% in the last 2 years, and for fee-for-service, for secondary health services, by almost 300% by the NHIA, while enabling the regulator, NHIA, to play its function. We're at that stage now where the President's direction to make subscription to a health insurance, an NHIA-approved health insurance, NHIA health insurance, mandatory for all MDAs, and also demanding compliance through all agencies that are responsible for complying, for entities that are doing business with government, to ensure that they have an NHIA-issued certificate on compliance, that they have insured their health workers. That is a key step to actualizing the mandatory health insurance that was approved by the NHIA Act of 2022, which had not been implemented until this administration, and in the context of the reforms that have been driven by this administration. So what it means is that the risk pool is being expanded. We'll see accelerated pace of improvement in enrollment in insurance. Over the last 18 months alone, more than 4 million Nigerians have been enrolled, bringing us to 20 million Nigerians covered, the first time in our history. Still a long way to go, but major uptick in terms of acceleration of enrollments of Nigerians to health insurance, thanks to the NHIA, but also to the state health insurance authorities and the contributory schemes in many of the states, and the private health insurance. So the movement has started for Nigeria to get towards universal health coverage. And this direction of the President, this decisive action approved by the President, I think will take us a lot faster, closer to that. And for the private sector, we encourage the private sector also to ensure that their employees are covered, because a healthy, protected employee is a happy employee, is a productive employee, and it will be an employee that will be more loyal. So private entities can also ensure their employees are enrolled in this direction. And the NHIA has put up a portal, to an enrollment portal, so that Nigerians can click in and enroll through the NHIA or through a HMO or a state health insurance authority. So this is a decision that was made within the context of a whole set of reforms in the health sector, but dealing with affordability, financial protection, but also with a view to equity. And not to forget that federal government itself has put its skin in the game for the vulnerable populations through the Vulnerable Groups Fund, who are being covered directly by public revenue through the BHCPF, 15,000 naira per year, which has been the premium that government pays for poor and vulnerable populations all across our country. And employers and cover through the NHIA insurance 37,000 naira per year to cover their enrollees. That allows us to have a risk pool that enables NHIA and others to pay for those services, HMOs, that population can have access, can afford those access. That is a start. There is a long way to go. Our goal is to get to 44 million or more Nigerians covered by 2030, which will change the dynamics in the Nigerian healthcare market and would allow Nigerians to access quality healthcare services. And with NHI as a regulator, they would also enable us to purchase, for Nigerians through the insurance program, purchase quality health services from providers, and as a regulator to ensure the standards are also met. So that's the import of what the President has approved, and we announced 2 days ago through the State House.
All right. Quite elaborate, Prof. I mean, for anyone wondering or thinking about the impact this would have on the future of our nation's public sector. But what systems are in place or have been put in place to monitor the performance of HMOs and health providers under this scheme? Who exactly is covered under this new health insurance policy? For the purpose of clarity, are contract staff or ad hoc workers and MDAs included? Will retirees or pensioners from federal service benefit in any way?
Well, this is covering the employees of those MDAs. And NHI is putting in place a digital platform so that the certification that is issued by it can always be verified. We think that it's in the interest of the MDAs, their employees, and our nation at large to ensure that the culture of insurance, prepaid health schemes, becomes dominant. Because every day, 70% of the total health expenditure in Nigeria is private, mostly out of pocket. Households pay for care, pay for drugs from out of pocket. Of course, there is a large component that is also financed through public revenues, through the primary healthcare efforts, through what state governments are doing, through what federal government is investing in the hospitals, but that's largely on the supply side. Still, there is a burden that is being taken by households, whether public or even private services, that are a large portion of where healthcare provision is taking place. So in that context, it is in our collective self-interest, in our enlightened self-interest, that the culture of insurance and prepaid health schemes becomes dominant, so that we widen the pool for those who can be covered through formal sector be covered, the informal sector employees to cover also, but also public revenues to be devoted for the poor and vulnerable. And NHI will establish that digital platform in relation to this particular mandate so that individuals and entities can verify whether a certificate, in fact, is legitimate or not. And I think it's one addition. In addition to that, NHI, of course, has the, you cannot enroll someone in health insurance in isolation. We must be able to tell. And anyone that is enrolled through the NHIA, for instance, and the VGF, on the Basic Healthcare Provision Fund, they also get to have their needs captured so that you can identify them. Essentially, this is one more piece in terms of the social protection mechanisms that are being put in place. Health is part of the social protection ecosystem that we as a country and as any country that is in our stage of development ought to put in place. It has taken a while for it to happen, but it is now happening. It is starting to happen, and we are very confident that under the leadership of the President, this will continue and be sustained, and Nigeria will get to the promised land in terms of having a good quality health system that drives the accumulation of human capital and the prosperity that is possible in our future.
All right, let's stay on this, Prof, because it looks like a lot is happening within the ministry. Earlier this week also, your ministry announced that President Bola Tinubu's administration is set to double its current health insurance enrollees from the current 20 million to over 40 million by 2030. And I remember that your ministry just broke the annual health insurance enrollment records with 2.4 million Nigerians enrolled last year. But how do you break that record and ultimately double the current pool of insured Nigerians in just 5 years?
Well, it's momentum, and I think we have the wind behind our back in the sense that we're seeing increasing revenues and allocation of public revenues towards health. We hope states will match that. We're seeing interest in the private sector. We're seeing HMOs innovating. So collectively, between the NHIS effort, between the states, as well as the private health insurance, we think it is doable. With the expansion of Basic Healthcare Provision Fund and the Vulnerable Groups Fund, we think that, in fact, we'll continue apace. So we are confident that the direction that the President has set is achievable. It's taken too long for Nigeria to get in this direction. But finally, we're moving, and thanks to the President for his leadership on that.
So what demographic groups are being targeted to increase enrollment to over 40 million? Is the focus mainly on the informal sector? I mean, I'm talking about vulnerable groups or private sector employees. How is government ensuring that vulnerable groups, I'm talking about the elderly, disabled, poor, IDPs are included in this expansion?
So ultimately, our goal is universal health coverage so that no one is excluded. The bigger the pool, the better for everyone. The formal sector employee, let's cover everyone. Let states join us in doing that so that working people and their families are covered. The informal sector is a bit more challenging because they are smaller, they are informal, but even them, there are innovation that will allow us to bring them in to the insurance program. And the vulnerable populations, pregnant women, children, that you've mentioned, elderly, those ones are covered through the Vulnerable Groups Fund and the tax revenues, the Basic Healthcare Provision Fund, which is a contribution of the federal government from the CRF, that pays to enroll those populations across our country, across the 36 states of the Federation, with the expectations that state will also match that. Essentially, to drive this reform and to get the health system that we need, all levels of government and the private sector will have to work hand in hand. And we believe that that is the direction, that's the right thing to do, and that with the steps that we have taken, we will get there over time.
And it looks like we're getting there, Prof. But if a worker has complaints or is denied care, what channels exist to report and resolve such issues quickly?
Yes, NHIA as a regulator, it's a single mandated regulator regarding health insurance in Nigeria. We've strengthened NHIA, and they do have a client complaint line. There are ways for those complaints. They've also got targets, and they're able to investigate and sanction HMOs if they are not functioning or doing what they needed to do, as well as in collaboration with the state health insurance authorities. So there is a regulatory framework in place through NHIA to ensure that Nigerians actually get the care that they deserve. Of course, you cannot completely guarantee 100% all the time, but at least the direction is towards improved responsiveness and with a regulator that is appropriate, that doesn't become the bottleneck, but that it's enabling for the insurance to be to function as expected, for the care package that is contracted with the providers to be delivered, and that reimbursements to also be made for services provided. And let me tell you, we're seeing, even regarding things like emergency obstetric services that we mentioned would be reimbursed through the government for cesarean section for pregnant women to reduce maternal mortality. Thousands of women have received cesarean sections and other emergency treatment for obstetric complications, reimbursed. We're working to hasten the period between when claims are submitted, verified, and paid by the NHIA. Same thing with things like fistula. We've seen women who have obstetric fistula, usually marginalized, left to be alone on their own, excluded by their families and their communities. But through this scheme, thanks to the President's leadership, in fact, we've seen thousands of women have had their fistulas repaired, women empowered and reintegrated, where that is done at no cost to them. Things like the Catastrophic Health Insurance Fund for catastrophic illnesses, cancer, kidney disease, spinal, those catastrophic health expenditures, there's a fund that is appropriate in 2025. NHI is in the process now of developing the operational mechanisms to get the funds so that those who have cancers, kidney disease, at least there will be some subsidization for them to be able to access the services that they need to survive. For many households, this is not an abstraction. Many households suffer when a member is diagnosed with a serious illness. They have to sell an asset, they have to borrow, they have to go to relatives. Unfortunately, because of the state of our development, some of that is occurring. But at least government is now trying to address that by putting mechanisms. And as we get wealthier, as the revenues increase, we do believe with the political will we're seeing, more and more of those subsidies will be targeted so that the burden on households can be reduced.
All right, Prof. Before we move on to other matters, I saw this before we came on air. Can you confirm that Nigerians can now enroll for the National Health Insurance Scheme from the comfort of their homes by simply making use of their NIN?
Yes, I can confirm that. The website is enrollment.nhia.ng.gov, I believe. It's an enrollment portal that NHIA has made available, and folks can log on, can enroll to the NHIA insurance or any HMO of their choice, or through the shares in their respective states. So that is at least a step that will make it easier for Nigerians to also enroll.
All right then. Let's move on quickly. Earlier today, you concluded a 4-day national health financing dialogue that was attended by hundreds of international donors and stakeholders from federal and sub-national public institutions. There were a series of announcements made, Prof. So I want you to tell Nigerians today, what can you tell Nigerians about what funding is coming into the Nigerian health sector?
Well, when we talk about health financing dialogue, it's about mobilizing the resources. It's about allocating those resources. It's about pooling the risks. It's about purchasing and also accountability. The health financing dialogue was sort of moved again along the directions that President Tinubu has granted to the health sector to accelerate the transformation of the sector. And we have had at least 2,000 participants, 1,400 of them online at different stages, and 600 to 700 at different times in person. Nigerian academics, civil society organizations, the health fellows, government officials in the federal level, state governments, state governors, the Governors Forum, the Minister of Finance, Minister of Budget. So it's a team effort alongside our excellent development partners, the Africa Union Commissioner for Social Affairs, Special Envoy of the Africa Union, the Regional Director of World Health Organization, former US Ambassador, and so many others, alongside our bilateral partners, the UK government and the US government, and many others who were in the room. An intense dialogue over 4 days to listen, not just to tell people, but to listen and engage in a dialogue, whether it's the civil society or different segments. And today that culminated in really the finale of that effort. And I think it's important to recognize that over the last 2 years, significant resources have been mobilized in support of President Bola Ahmed Tinubu's reforms in the sector. You recall in December 2023, 3.3 billion was announced by our donors to support the government's effort. That is complementary because at the end of the day, domestic financing, the financing of our government is a key driver of what we are doing, is a key driver in the context of domestic financing is the largest chunk of the total health expenditure in Nigeria. The external funding is a much smaller portion, but an important portion which we appreciate. So over the last 2 years, we've seen the execution of that, whether it's the IDA Project Hope, which has all the 36 states part of it, or the Multi-Donor Trust Fund, which has grant financing from several actors, philanthropies that have contributed in that, or the Basic Healthcare Provision Fund, which we have been implementing and has disbursed billions of naira to thousands of primary healthcare centers all across our country, and has also dispensed funding through NHIA for the capitation for the Vulnerable Groups Fund. So we've seen the outcome of that is that utilization of primary healthcare services in areas supported by the federal government has increased. In the first quarter of 2025, 37 million visits all across this country. Visits, not necessarily individuals, from January to March, compared to just about 10 million a quarter in 2023. And from April to June, 46 million visits, which were recorded, and the data that was provided to me showed that, which means a pregnant woman can make 2 or 3 visits, but at least the visits are happening at a higher rate than it was in the past. And perhaps we are also capturing this visit better, which means that Nigerians are beginning to realize that the reforms that the president directed us to do is working, and people are stepping up to enjoy those services. The health workers have been retrained, the commodities are improving, still challenges in terms of affordability for some that are not available, but at least there is a movement towards improvement. So the dialogue was to take stock of that, learn from global best practices, and other countries also came to Nigeria to learn about these reforms. This week, we have the entire delegation from the Senegalese Ministry of Health in Nigeria, from their Ministry of Budget, Ministry of Finance, and Ministry of Health, and their partner, to come and study what Nigeria is doing, because what the president is doing in Nigeria's health sector is being noticed all across our continent and indeed globally. And we have begun to see folks coming to Nigeria. And this week, this Senegalese delegation came with the purpose of only to learn what Nigeria is doing so that they can also see how they can adapt it in their context. So that is the purpose of this. And then the way forward, the articulation of what we would do next was the conclusion that you may have had announced in terms of how do we sustainably and equitably, efficiently and effectively finance our healthcare system into the future in the face of declining global financing and exiting from dependency so that our domestic financing supports our priorities. While we are still relatively less resourced, we know that there are opportunities that are ahead of us, thanks again to the macro-fiscal reforms of this administration.
All right, Prof.
We've seen increases in revenues to all levels of government. We've seen the revenue to GDP increase from 7.5% of GDP in 2023 to 11.5% in 2024. More than doubling of the revenue between 2023 and 2024. And 2025, that has continued. Federal government and states. So how do we ensure that we align together, that the revenues accruing to the state is also channeled to support this direction that the president has set for the health sector? And how do we optimize with the development financing that comes into this country?
Right. So at this point, let's take a break. And when we come back, we'll continue this conversation. This is Politics Tonight, everyone. Please stay with us.
Good morning, Marina Station and all the passengers. Efficient, it's comfortable.
This development will go a long way in reducing congestion and emission.
The trains are a long-term solution to Lagos traffic challenges.
This is where we take the final, decisions on policies, programs of government. I will have to ensure that, the narration of Lagos as a PLC, is taken very, very seriously.
This is a major pedestrian bridge linking Oyinbo here to Apapa Road over there.
With this overpass, we are providing what we call a permanent solution.
This place is one of the most dangerous areas at the biosecurity environment.
This can go into the news and every crimes of your neighborhood.
Our goal is to remain as Africa's model megacity, to move our GDP from the 5-6 position to the 3rd position, and we believe it's achievable with all the commitments we have.
Explore the city of Lagos, where dreams are made and possibilities are endless. Amadedoja Salamadeniyi. I live in Lagos, inside Lagos.
I write to request the kind approval of the National Assembly.
Behind every decision, every vote,
The ayes have it.
and every heated debate lies the heartbeat of democracy.
This matter is very, very important.
I therefore rule you out of order.
Welcome to the place where it all unfolds. Every week, I take you inside the inner workings of the assembly, where laws are shaped, decisions are made, and the future of the nation is decided.
The ayes have it.
Join me, Tijesu Adeoye, and other seasoned experts, analysts, and lawmakers at the National Assembly as they uncover the real stories behind the headlines and offer unfiltered insight on the most pressing issues of the day. This is your front row seat to the heart of power. Watch the Hallowed Chambers every Saturday at 9 p.m. only on TVC News.
Welcome back to the program, everyone. Thank you very much for staying with us. President Bola Tinubu has directed implementation of compulsory health insurance across MDAs in line with the National Health Insurance Act 2022. And I've been speaking with the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate. Thank you very much for staying with us on the program, Prof. I want us to continue from where we stopped before we went on that break, because, a major domestic resource mobilizer in Nigeria at the moment is the Basic Healthcare Provision Fund. And before we went on break, you said over 37 million primary healthcare visits have been recorded under this administration. You had also said that a massive investment of over 50 billion naira have been applied to the rehabilitation of several thousands of primary healthcare centers across all LGAs in Nigeria since 2023. Is this something that can be further scaled up? What is the long-term vision for sustaining the gains from the BHCPF and this PHC rehabilitation investment? Are there plans to scale up funding or introduce complementary programs?
The vision is a healthier Nigeria, healthier, better health for all Nigerians. And to achieve that, there is an element that has to do with the care and treatment through primary health care, through secondary care, and through referral at the tertiary and even quaternary services. But an important dimension that I also need to highlight here is the preventive aspect. We need to produce health, the stock of health, by preventing illnesses, because it's much more cost effective. So there are other interventions to actualize that vision. For instance, looking at our food systems, dealing with issues like processed foods, zero trans fat, low salt diet, to stem the tide of non-communicable diseases that are the fastest growing burden of our disease, fastest growing burden of disease in our country, and water and sanitation. Other intersectoral determinants of health, which have been channeled not through the Ministry of Health, but other sectors. Education and what happens in the school health arena. Those are also equally important in terms of the health of our population, alongside the healthcare related investments that we have started to expand and will continue to expand. Now, the outcome of the dialogue that finished today, for instance, suggested that, in fact, Basic Healthcare Provision Fund may be increased over the at least 1% provision if, for instance, the legislature were to pass an amendment that puts it at 2% and that is agreed by stakeholders. That will double the resources, and as the revenues increase, we'll have even more resources to go faster. We're also using the Project Hope, an IDA-supported project, to expand beyond the 8,800 to additional 4,000 facilities that will be receiving the direct facility financing through the sector-wide approach. So all those efforts, complemented by expanding the Vulnerable Groups Fund and the insurance, will mean that our population will be able to access increasingly over time quality healthcare services, basic healthcare services, and that the poorest and vulnerable of our population will not be left behind. And for higher, more sophisticated care, the public sector investments we'll be making through our teaching hospitals, through other centers that have been created with the support of NSIA, for instance, will be available. But there are also many private sector investments that are coming in to deliver quality specialist services to Nigerians. And then, of course, technology that will allow us to leapfrog. Earlier this week, we launched Care 365 Health Hub, which is a desk that will allow for mobile health, for easy, portable diagnostics, for referrals, for having good data that is owned by the patient and over time that is transferable, and many more innovations.
All right.
There are also other ways,
But most importantly, Prof, how are you ensuring that these funds are not misused or diverted at the state or local level? Are there financial tracking tools or community monitoring mechanisms in place? Also, how are communities being involved in monitoring and taking ownership of the upgraded PHC facilities?
I think you have to understand, I think we're very fortunate that I would say almost a political genius is our president, because you may have heard about the ward-based development approach that the president is pushing. In the health sector, we have ward health system and ward development committees in thousands of our communities. Everywhere there are primary health care centers that are supported by BHCPF, we also organize ward development committees. And those ward development committees contribute in the oversight over those facilities that are in their communities. So it is with their participation and they help with their accountability. In addition, we deployed 774 brilliant Nigerians under the National Health Fellows Program, which was launched 6 months ago by the President. They are active, they are vibrant, they are already playing that role alongside other actors like the PFMOs that have been deployed. In addition, we have involved an entity, ICPC, which is an independent entity that is helping stem corruption to ensure that in a preventive manner, they also work with us to check where those flows, where those direct financing are going, that the folks responsible for managing those resources are channeling those resources to their intended use. It is not perfect, and in some areas, resources may be spent, and the capacity to report the spent resources appropriately so that it's auditable may not be there, but we're rectifying in an adaptive manner. And we've already had an audit of the BHCPF covering several years before this administration, and currently, in fact, the audit of the last year is ongoing, and we don't expect it to be perfect, but we're on a trajectory that says we can improve. It's not about what the past was. It's about going forward. What do we learn and what can we do to improve transparency and accountability? And
Prof, let's go back to a major achievement in the early days of this tenure. I remember you broke ground on phase 1 of Mr. President's large-scale investment in oncology and cancer treatment centers across the geopolitical zones across the country, beginning with a set of 3 cancer centers that were commissioned in June, in keeping with your earlier promise. But I now understand that there is a second phase of new cancer centers that are on the way. Where are these new centers located, and when can we expect these ones to be completed?
So I have a lot of good news to share, I think, on this since the last time we spoke. Of course, there's an oncology center in Sokoto. There is one that has been reactivated in Maiduguri at the University of Maiduguri Teaching Hospital. And alongside the Minister of Finance, Minister of Information, we inaugurated the one in Katsina, in Benin, and in Enugu. The 2 linear accelerators at the National Hospital will be back online. I think they are. And we are getting a private entity to support the service level agreement to make them functional before newer ones are placed at the National Hospital. Just University Teaching Hospital, Ahmadu Bello University Teaching Hospital, additional one in Lagos. Lagos had 1 or 2, I believe, linear accelerators already, and additional ones will be put in place from the public sector side. So there are so many large-scale investments, not only on oncology but on the diagnostics that are being done directly through the public sector, but also through the NSIA's arm, MedServ, which is a Nigeria national, which is a public entity as well, so that the infrastructure for quality diagnosis and care of cancers is done, in addition to the human resources to provide those quality services. And we're beginning to see some private actors, like Master Ruth in Lagos, for instance, a wonderful facility, a private facility, providing quality services and attracting patronage from folks in our sub-region, in the West African sub-region. And over time, I believe that we may begin to see even people from other farther parts of the world coming to Nigeria for care. So those are the strides that we have been making, and thanks to the President, but also to the Minister of Finance for enabling those resources to be made available. So for the second phase, which is ABU, JUTH, and the Lagos facility, we expect in the next 12 to 18 months for them to also be made operational.
But Prof, you know, affordability of cancer care remains a major barrier to care for most Nigerians. And I'm wondering, what is this administration doing to bring down costs? And how sustainable are some of these subsidies, the Tinubu administration's subsidies in the health sector more broadly?
So, even if you have $1 billion to pay for care, if the facility to provide the care is not available, there's nothing that will happen. You'll have to go somewhere else. So solving that on the supply side is what we have done, and in an unprecedented way over the last 18 to 24 months, and we're seeing that concretely on the ground. We're pivoting in terms of the affordability aspect. And of course, I've mentioned extensively the insurance, and because some of these facilities are public, by default, those public investments are subsidies for those who will use them, because the pricing will be much lower than if it were just a private for-profit entity. In addition, in 2025, the President approved $25 billion to the NHIA for a catastrophic health insurance fund, which is targeted at ensuring affordability of cancer care, kidney, end-stage kidney disease, those who are dialysis dependent. NHIA is putting in place the operational mechanism, and we will then request the Ministry of Finance and Ministry of Budget to provide those resources to NHIA so that those who are afflicted can have those subsidies beginning to kick in. As more public revenues are available, as the windfall of the reforms of the President continue to grow, then the revenue can be channeled more towards financing health. We have to connect the macro-fiscal reforms that the President did to the relief that we're beginning to see and what we will see going forward. So the difficult choices that the government had made, of course, there were tough times, but we believe that we're turning the corner, as we can see in the revenue of government. Because without the revenue, all these items, the investment in oncology services, expansion of insurance, expansion of primary health care, will not have happened without the tough choices that the President made and the Minister of Finance and the economic team.
All right, Prof, quickly, and that reminds me, because a few weeks ago there was this, back and forth on social media, and I'm sure that happened because there was no clarity. The information was that President Tinubu had approved a reduction in the price of each kidney dialysis session from 50,000 naira to 12,000 naira. I want you to help us with some clarity on that. And how soon will this new dialysis price take effect? And across how many facilities nationwide? Will this apply to both public and private hospitals or only government-owned dialysis centers?
You see, dialysis is a specialized procedure which is only available in certain hospitals. It's not something that you walk to any hospital. And it has to be a facility that has the trained manpower, that has the supplies to be able to offer them. And for the first time in 2024, we provided consumables for dialysis to 8 federal tertiary hospitals who are qualified, have the facility, the trained manpower to provide them as a subsidy in kind for them to lower the cost. Many of those facilities then went ahead and reduced the cost to $12,000 per session, which is a major reduction, and that has benefited a lot of Nigerians who have accessed those services. We've renewed that, and I believe that there are other entities, there are philanthropic bodies, foundations that are also contributing. The bottom line is that kidney disease is an issue that we will continue to face. And end-stage renal disease is something that we have to double down to reduce its occurrence. Part of it is very preventable. Hypertension and diabetes are the drivers. When uncontrolled over time, they lead to kidney damage, up to the point where an individual may lose their kidney functions completely. So the prevention, the production of health, the control of non-communicable disease like diabetes and hypertension, the treatment of early, the screening, the Know Your Numbers campaign that we did, to prevent those diseases is the best path forward. Waiting until we get the dialysis and depending on offering dialysis, whether at subsidized or full rates, is not the best path. And so we're balancing the imperative to treat those who are afflicted today, but ensuring that the hundreds of millions of Nigerians that are currently relatively healthy will remain so over time. We have to take a holistic approach. In the context of the health sector, the entire population of our country is our client. And those that are sick, we have to take care of them.
All right.
Those who are sick but don't know they are sick, we have to diagnose them. But those who are healthy, we have to also try to keep them healthy. And so we have to take those approaches, not just look at the treatment as the ultimate, because ultimately the numbers might overwhelm the resources that we have, given that we have limited resources. So it is an effort to bring relief. Yeah.
All right. So also, before I let you go tonight, you led an effort to put an end to significant industrial unrest in the health sector. But some Nigerian doctors and nurses have complained about being overworked to exhaustion. What measures are you putting in place to ensure that medical personnel are best positioned to succeed on this job and are fit to give Nigerians the care or the best care possible?
First of all, I think it is very clear that we appreciate profoundly the sacrifices, the hard work, the diligence of the more than 300,000 healthcare workers across our country of different cadres, the physicians, the surgeons, the nurses, pharmacists, the non-clinical workers, the administrators, laboratory scientists, all of them. Some in difficult circumstances, some facing challenges of security, but they've continued to provide services and kept faith. We've worked to expand the infrastructure, the quality of the infrastructure and equipment. We've worked to retrain many of them. We also have recently and have enjoyed almost 2 years of relative peace in the sector. There was no major disruption over the last 2 years in terms of this administration, because we have worked hard to earn trust and keep that trust, just as the leadership of those unions, whether it's the NMA or the nurses or Johesu, they realize that the president means well and that we're working hard to make things better. But as always, there are issues that emerge, many of which are legacy issues. There were issues negotiated 2009, 2001. There were agreements made by government in 2016 which have not been implemented, and those had languished, and those were brought up. And when nurses decided to give an ultimatum and we engaged to discuss them. Those are issues that were long-standing.
All right.
But with the constructive engagement we had with them, with the intervention of the president and their own leadership in a forward-leaning way, realizing that at the end of the day, we are all on one side. We're on the side of the Nigerian patient, Nigerian person. We're able to curtail that short disruption and get on a path of collective bargaining agreement mechanism that is now in place.
All right.
The same thing with the Nigerian Medical Association. Long-standing issues, advocacy for increases in their allowances and all of that. We're able to intervene, and thanks to the leadership of the NMA, the president and also the state chapters and their leadership and previous presidents of the NMA, they saw the imperative to rally around and have the Nigerian person at the center. And they were able to work with us to arrive at a resolution, and that has now led us to a collective bargaining agreement process that is in place.
Thank you very much.
I think that is notable. May I also just mention Jehesu also? I think there are all kinds of grievances, but we are doing our very best to address them so that we have less disruption in healthcare services for Nigerians.
All right, then, Coordinated Minister of Health and Social Welfare, Professor Muhammad Ali Pate. Thank you so much for speaking with us on Politics Tonight. Thank you, and well done.
Thank you very much.
All right. And thank you very much for watching, everyone. That marks the end of today's episode of Politics Tonight. But before we go, let's tell you that the views and reactions of our resource persons are theirs and have no connection with TVC News. Meanwhile, you can watch the repeat broadcast of this episode at 12:30 a.m. Get in touch with us on our social media handles, Facebook, Instagram, and X at TVC News NG and at Olajuwon Kedebu using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News NG. I am